Have you ever caught yourself wondering, is it still safe for me to masturbate at my age? If you're over 60, you're not alone. Many men and women quietly worry about this. They don't ask their doctor. They don't tell their partner. They just keep it as a private fear. Maybe you've noticed changes, slower arousal, less sensitivity, erections that don't last as long, or even a bit of pain, dizziness, or discomfort after orgasm. And a small voice inside asks, is this normal? Or am I harming my heart, my prostate, or my body? I'm Dr. Rosalia Viterbo, urologist, and in this video, I want to talk to you openly, calmly, scientifically, and without judgment, because masturbation after 60 is not dirty. It is not shameful, and for many people, it is actually healthy for your mood, your sleep, your confidence, and even your relationship with your own body. But there are mistakes that people make at this age, mistakes that can cause pain, trigger unnecessary anxiety, or even put your cardiovascular health at risk. In this video, I'll show you how to masturbate safely after 60. I'll explain the 3 big mistakes I see most often in my patients and what you can do instead. You don't need to feel guilty. You just need the right information. Stay with me. Let's talk about pleasure, safety, and aging in a way that respects your health and your dignity. Let's talk about why this matters. You want pleasure. You also want safety. After 60, both are possible. But your body plays by new rules. Hormones shift. Testosterone and estrogen drift lower. Arousal can feel slower. Lubrication changes. Erections may be softer or shorter. That's biology, not failure. Chronic conditions join the conversation. High blood pressure, diabetes, high cholesterol, enlarged prostate, arthritis. They all affect blood flow, nerves, and comfort. So does surgery history. So do common medicines. Blood pressure pills can cause dizziness. Antidepressants can blunt desire. Blood thinners can bruise delicate skin. Energy is different now. You might feel more fatigue at night. Sleep is lighter. Stress lands heavier. Grief, loneliness, or caregiving strain can sit on your chest. These emotions touch your desire. They also shape how you touch yourself. Many people don't ask questions. They feel shy or worry a doctor will judge them, so they guess. They push through discomfort. They copy what worked decades ago, and they ignore warning signs. Here's the quiet fear I hear most: can masturbation hurt my heart? Usually the effort is similar to climbing a few flights of stairs. If you can do that comfortably, you're likely safe. But intensity, dehydration, and certain meds can tip you into lightheadedness. That's scary when it's unexpected. Skin is thinner now. Tissues are drier. Pelvic floor muscles may be tight or weak. Technique matters more. Pressure matters more. So does lubrication. Confidence is fragile. If arousal stalls, you may feel broken. You are not broken. Your body is asking for adjustments, gentler pacing, better tools, smarter positions. Let me ask you something. Do you prepare your body for pleasure the way you would for a walk? And do you match your approach to your health or to your memories? This matters because sexual wellness is health. Good sexual health supports mood, sleep, and intimacy with yourself. It can ease stress. It can restore a sense of control and warmth. You deserve that. With the right steps, you can have it safely. I'll show you how. First, check your heart and set a safe pace. Sexual arousal raises heart rate and blood pressure briefly. For most healthy adults, that demand is modest and temporary. A good rule is the stairs test. If you can climb 2 to 3 flights comfortably, you're usually safe. If stairs leave you breathless or dizzy, slow things down. Choose a seated or semi-reclined position to reduce strain. Keep your neck supported and shoulders relaxed. Breathe steadily. In through your nose for 4 counts, out through your mouth for 6. This lengthens exhalation, lowers sympathetic drive, and calms your heart. Warm up first. Use a warm shower, gentle stretching, or a heating pad on low muscles. Loosen. Blood flow improves. Nerves wake up without shock. Keep water nearby. Dehydration increases dizziness and cramps. Pause if you feel chest pressure, jaw pain, new shortness of breath, or a cold sweat. Those are red flags. If they occur, stop and call your clinician. Don't push through warning signs. Safety earns confidence. Confidence supports pleasure. Second, protect your skin and sensitive tissues. Aging skin is thinner and drier. Friction that felt fine at 30 may now irritate. Lubrication is not optional. It's protective. Water-based lubricants are versatile and easy to clean. They play well with most toys and condoms. Silicone-based options last longer and resist drying. They're helpful if you struggle with dryness or longer sessions. Avoid oils with latex products, since oils weaken latex. If you have sensitive skin, patch test a pea-sized amount on your wrist. Wait 24 hours for any redness or itching. Apply generously, then reapply. You'll use more than you expect. Think glide, not grind. Reduce pressure. Alternate motion with stillness and breath. If you use toys, choose smooth, body-safe materials. Look for medical-grade silicone or stainless steel. Avoid porous materials that trap bacteria. Start small and gentle. Bigger is not better if it causes numbness or micro-tears. Clean toys with mild soap and warm water after each use. Let them fully dry. Store them in a breathable pouch. For people with vulvas, consider a silicone-based vaginal moisturizer on non-play days. It supports tissue comfort and elasticity over time. For people with penises, watch your grip. A very tight, fast grip can desensitize nerves temporarily, ease the pressure. Vary your technique to keep sensation responsive. Third, align technique with your medications and conditions. Many common prescriptions influence arousal, sensation, or blood pressure. Blood pressure medicines can cause lightheadedness when you stand quickly, so favor seated or lying positions. Move slowly when changing posture. Antidepressants may delay orgasm. That's frustrating, but manageable with pacing and variety. Try rhythm changes, temperature contrast, or fantasy cues to re-engage attention. If you use ED medication, remember safety basics. Never combine PDE5 inhibitors with nitrate drugs. That mix can drop blood pressure dangerously. If you take alpha blockers for prostate symptoms, separate timing from ED pills as advised. Your prescriber can tailor doses and schedules for comfort. Diabetes reduces nerve sensitivity and dries skin. Moisturize regularly. Keep glucose as stable as you can. Check for any skin breaks or fungal irritation and treat early. Arthritis affects hands, wrists, and hips. Use pillows to support joints and reduce strain. Hands-free toys or soft sleeves can help when grip is painful. Neuropathy changes feedback. So favor slow, mindful touch. Use visual focus or audio cues to keep your brain engaged with sensation. If you're on blood thinners, be extra gentle. Avoid intense suction or firm edges that bruise easily. Replace anything that pinches or leaves marks. Fourth, train your pelvic floor and nervous system. Pelvic floor muscles support arousal, orgasm, and bladder control. With age, they can become tight or weak. Both patterns reduce pleasure. A simple routine helps. Inhale and let your belly soften. Imagine your pelvic floor blooming and widening. Exhale and gently gather the muscles like lifting a blueberry. Hold 3 seconds. Release fully for 6 seconds. Repeat 5 to 10 cycles daily. This builds strength and flexibility together. If you feel pelvic pain, focus more on relaxation than on squeezing. Warmth, slow breathing, and a few minutes of gentle hip circles help. For people with vulvas, a small external vibrator can enhance blood flow and comfort. For people with prostates, external perineal massage may feel soothing and reduce tension. You don't need deep pressure. Think wake up and reassure, not force and conquer. Your nervous system loves predictability. Create a simple pre-pleasure ritual, dim lights, turn off notifications, play calm music, tell your body you're safe. When the brain believes this, arousal follows more easily. Finally, plan recovery and set realistic expectations. After 60, arousal starts slower and resolution takes longer. That's normal physiology. Build in a gentle cool down. Lie back, breathe slowly until your heart rate settles. Sip water. If you're prone to cramps, add magnesium-rich foods in your routine. A warm compress on the lower abdomen can ease post-orgasm aches. Urinate afterward, especially if you're prone to UTIs. Clean any devices and your hands with soap and water. Check your skin briefly for redness or irritation. Small irritations heal best when noticed early. Consider a rhythm that matches your energy. Pleasure 3 to 4 times weekly suits many people. Daily is fine if you feel good and recover well. Less often is also fine if your desire is low. Don't chase a number. Chase comfort and satisfaction. If your confidence dips, remember that desire fluctuates with sleep, stress, and mood. You are not broken. You are adapting. If pain persists or you struggle with erection, lubrication, or delayed orgasm, talk to your clinician. There are safe, evidence-based options. From pelvic floor therapy to medication adjustments, help exists. Your sexual wellness is part of your whole health. Treat it with the same care you give your heart, joints, and mind. With pacing, protection, alignment, training, and recovery, you can enjoy safe pleasure at any age, especially now. Let's bring this together in a calm, clear way. Your body has changed. Your right to safe pleasure has not. You deserve confidence, comfort, and control. First, think heart and pace. Use the stairs test as your guide. If 2 to 3 flights feel fine, light sexual activity is usually fine. Choose seated or reclined positions if you're unsure. Warm up gently. Breathe slowly. Hydrate. Stop with chest pressure, jaw pain, new shortness of breath, or a cold sweat. Those are warning signs. Safety comes first. Second, protect your skin and sensitive tissues. Aging skin needs glide, not grind. Lubrication is protective, not optional water-based for versatility. Silicone-based for longer glide. Avoid oils with latex. Use smooth, body-safe toys. Clean and dry them after every session. Ease your grip. Vary technique to keep sensation responsive. Third, match your approach to your health and medicines. Blood pressure pills can bring dizziness. Move slowly and favor supported positions. Antidepressants can delay orgasm. Shift rhythm, focus, or sensation to help your brain re-engage. Never combine ED pills with nitrates. Coordinate timing with alpha blockers. With diabetes, moisturize, inspect skin, and keep glucose steady. With blood thinners, be extra gentle and avoid firm edges or intense suction. Replace anything that bruises. Fourth, care for your pelvic floor and nervous system. Practice relaxed, gentle Kegels with full release. Use warmth and breath to ease tension. Small external vibration can improve blood flow and comfort. Perineal massage can soothe. Create a simple pre-pleasure ritual. Dim lights reduce interruptions. Tell your body it is safe. Calm brains feel desire more easily. Finally, plan recovery and set realistic expectations. Arousal may start slower and settle slower now. That is normal. Cool down with slow breathing and rest. Sip water. Use a warm compress if you ache. Urinate to reduce UTI risk. Clean devices and hands. Check your skin for irritation. Choose a frequency that fits your energy and mood. There is no perfect number. There is only what feels good and leaves you well. Always listen to your body. If discomfort persists or confidence sinks, talk to your clinician. Small adjustments can create big relief. Sexual wellness is health. It supports mood, sleep, and the quiet warmth of self-respect. You are not broken. You are adapting. With thoughtful pacing and care, safe pleasure after 60 is absolutely possible and deeply worth it. You've done something important today. You chose clarity over worry. You chose care over guesswork. If this helped, stay with me. I teach sexual health with calm science and real-life tools. No shame, no noise, just practical steps you can use tonight. Subscribe to the channel, turn on notifications so you don't miss the next lesson. I'll cover topics like pelvic floor comfort, medication timing, and safer toy choices. Short, clear videos, doctor-backed guidance, always respectful. If you have a question, write it in the comments. Ask about dizziness, delayed orgasm, dryness, or confidence. I read them. I use your questions to plan future episodes. Your story will help someone else feel less alone. Share this video with a partner or a friend who might need gentle guidance. Learning together protects health and strengthens connection. If you're dealing with ongoing pain, new symptoms, or complex medications, talk to your clinician. Bring notes from this video. Small adjustments can create big relief. Thank you for trusting me with your time and your health. You deserve safe pleasure and steady confidence at any age. Take care of your health. See you next time.